Good day, everyone, and you are welcome to our second class on CHCAGE001 or 011, that is providing support to people living with dementia. Today we are going to be starting with our roles and responsibility in supporting people in our care who are having these particular diseases. So all aged care worker or all aged care provider must meet this standard, which the summary is as follows. All aged care provider, that is the organization where you are going to be working, they have to always provide what we call dignity and choice. Dignity and choice is giving the right as well as opportunity for the person that is going through these diseases to make their own choices. We don't say because they are not in the good space now, or because the diseases is getting they are declining with the diseases, we don't give them opportunity to have a say in the level of care that we are providing to them. We should always give them opportunity to decide. If you go into someone house, someone that is having dementia, if you go to their house and you want to assist them with activity, daily living, you can give them option of wearing white or blue shirt. You can hold the two shirts out and allow them to decide which one they are willing or they want to choose or they want to wear that day. So this is an example of giving someone dignity and choice. Ongoing assessment and planning needs to always be provided. Ongoing assessment in the sense that we need to understand how the diseases is actually affecting them. Are they declining so fast, or can they still manage? And what are those supports that we need to review or we need to put in place due to this level of declining that we have identified. Personal and clinical care. This also associated with declining. What are the personal care and what are the clinical care we are going to be providing? Maybe we need to get them more medication to be able to support their emotion better. This is an example. Services and support for daily living. That is way that we are going to be working in that environment. We care workers, support workers, what are the qualification or what are the experience that is required of us to be able to really support these people living with dementia. And lastly, organization's service environment. The organization environment is expected and must be safe at all times for people living with dementia. Knowing the expected conduct of aged care worker will guide you in performing your own tasks. In working with people with dementia, you as an aged care worker, you have to show some quality of empathy and patience towards the individual you are providing care for, and you have to keep in mind the fear and frustration that must be by that person, that the individual might be going through, because they might try to tell you something and because they forget it, it will be quite frustrating. Or even if they are seeing you for the first time or they've been seeing you for so many times, but you coming into their face that time, they might be see the brain might say they are seeing you for the first time. The next thing is they will be fear of, or they are scared of you, or they are kind of frustrated that they don't even remember you. So you need to be patient with them. You need to show that level of empathy. You need to give them their dignity, respect their rights with regards to whatever services you're providing. An individual plan. So identify specific needs and preference of the person based on their individual plan. As I said earlier, because someone is declining doesn't mean they don't have preference. Give them opportunity to choose either from white shirt or blue shirt. Give them opportunity to decide what they want to put on today and give them opportunity to decide whether they want to drink uh, the Milo, or they want coffee this morning, they want it cold or warm, things like that. Engage them. So an individualized plan is a document that provides those receiving aged care services. A care team creates this plan together with the older person and their carers. They discuss the services that the person will be receiving, such as medication and therapy, to support them in their daily living. They also discuss the challenges and interests of the person. It is important for you to read this individualized plan in order for you to, of course, get to know the person better before you start supporting them. And it also help you get to know the person, because ideally they will be part in preparing this individualized plan. Identifying the needs of people with dementia will help you to provide the appropriate support for them. Identifying their preference will also help you to keep them to keep them engaged, and they will be happy with you at all times. To familiarize yourself with someone's need, you need to identify their difficulties and how can you, of course, make a difference in that situation. Um, Preference can come in so many ways. We've given like few examples. Other than that, if someone wants to go do different activities, let them decide which one will be the best that they want to do at that time. If you have like bingo, or you want, or they like to play chess, give them options, and let them do what is it that they believe they can actually be happy with as at that time. Interact with person using person-centered approach. Person-centered approach are strategies that focus on the person's strengths, which aim to protect the person's right and dignity. It means providing care that is different, or that is designed specifically to meet their wants and their needs. This approach sees people as an individual with needs and not the problem to solve. So person-centered approach is seeing that particular individual and not the diseases. Seeing me as the trainer, and not seeing me as my has been King, or has been Ben, and not that guy with dementia. So understanding that there is a person behind that disease is very, very important. Using personal-centered approach can enhance pleasure, as it focuses on interest and desire of the person, which means you should focus on doing things that brings them joy. Don't think that, oh, you believe this is the right thing, then that will be the best thing for them. No, let them decide what brings them joy, and walk that path with them. Doing the things that make them happy will, of course, boost their morale. And being idle tends to have negative effect on people's physical as well as mental health. So on every day, on a daily basis, if you are supporting someone with dementia, try to keep them active, try to keep them engaged. Look at what is it that they love doing, and plan with them their day accordingly. So people need stimulation to keep their mind active and boost their mood. Just like you and I, we need to have something like this. Try to help them as well to achieve this goal on a daily basis. Here are some examples of person with dementia. What person with dementia can do. 1. Activities that causes sense of person value. One of them is helping in public daycare center, or walking dogs in animal shelter, helping to clean up parks, cooking for homeless shelter. These are something that can create and give people this personal value. Some of the activities that help with self-worth include making art and displaying them in a gallery. There's a lot of elderly people, even while they are still going through these diseases of mental health or even dementia, they're still very skilled. So if you can sit down with them and help them to bring out that strength that they might be forgetting, and allow them to print or paint something good, you can work with them and show it or display it at a gallery. You can even do like a social function for friends and family to come in and see what their loved ones has really put together, and make it fun. So joint talent show with other people, telling stories about their lives to their older adult or even the younger ones or the children, and teaching skills that they have to others. These are some of the things that can always improve people's self-worth. Try to engage them and help them to achieve this goal. Provide and maintain a stable and familiar environment to support their personal well-being. For people with dementia, the environment is very, very important to make them feel stable and familiar in that environment. It will cause them more distress if their environment is unstable or unfamiliar. So this is why it is important to ensure a good environment for them at all times. For example, um, we need and this happen a lot even when we are working in the industry, that people with dementia, they want to sit at a particular spot at all time. If they are not sitting at that spot, or maybe during breakfast, this is where they normally sit, and someone or different person is sitting in that location on that day, that it might really affect their mood. It might really affect their the way they function that day, because the environment or the place they will be sitting, they are not familiar with it. So as a staff or as a care worker, we should try as much as possible to manage this ahead of time. You know your client that wants to sit in other people's place, try to engage them, try to redirect them and get them to sit at their right spot, so that they don't affect other people's or invade other people's privacy. So to avoid or to provide a stable and familiar environment, we can do the following. One, avoid moving things around when they already know where they can find them. Two, inform the person of upcoming changes. These include new structures, routine, or even staff members, so that they don't feel, oh my god, what is happening? So that you can keep them up to date. Providing familiar environment can also establish a routine with them, put up signs around the place to help them to navigate better, avoid sudden changes such as transferring them from one room to another. All this will, of course, lead to a lot of distress. We don't want people with dementia to be having such level of distress in their life. So the person environment impacts how you can support them to engage with. So if you provide them with a good environment, they may require less direct support. For example, now someone that has dementia and they are living in their house, you've painted their toilet in probably green or red, something that they can easily uh, identify from anywhere. If they feel like going to toilet, instead of them coming to you or instead of them even doing it anywhere, they will look around and they say, okay, that's the color of the that's the color indicating the toilet. They can easily navigate themselves and do their business. Of course, in this way, you are increasing their self-worth. You are helping them to be much more uh, you allow them to make the right decision at the right time, and of course for them to be much more independent. So to create a physical environment that has a good impact on a person, you can do the following strategies. One, keep the area clean and free of clusters. Use constraint color to make things easier to find. Just as I said earlier, maybe you make it red or blue that is so conspicuous that they can easily know this is where I'm going. Keep the area well light but not too bright. Also keep the background noise low and make it in a very soft manner that they can easily understand. As an aged care worker, perform your role to the best of your abilities by making sure to monitor the person's health and well-being. Help contact the person, help connect the person to the other people who share their interests through club or online forum. So we assist the person in socializing with others by taking them to the community space where they can safely interact with others. Example might be you taking them to have a coffee, or even you taking them to art gallery whereby they can paint alongside other people with same like or similar interests. The next thing we are going to be talking about is identify and refer solution outside our job scope. It is very, very important for us to know what our limits are, and whatever it is that is out of our limits, out of our job expectation, we should not do them. So when working with people with dementia, you should know what you are and what you are not qualified to do. You should know your roles and responsibility towards the people you're working with, and who you can, of course, rely on to give you the right information and direction. Understand your job role enables you to identify situations outside of it. So understand this also help you to refer situation to the right person, the person that you probably your supervisor. In most cases, if you are working in HK, you will talk to your nurses or enrolled nurse or team leader depending on what is happening at that time. So to identify situation out of your scope, you should first determine the limit of your role. To do this, read your uh, job description. If anything is unclear, talk to your supervisor for better clarification. When you identify your tasks, you are not, of course, and you identify things that you are not qualified to do, you should know how to refer them to the right person. So knowing whom to refer situation to is also very, very important. So in other words, try to familiarize yourself with the organization chart. This is where we are going to be stopping today's lecture, and I will see you on our next video. Thank you for joining. Bye for now.